Hey, everybody, let's talk about this issue we're seeing out there developing, trapped in Medicare Advantage. Okay. We're seeing more and more of these big doctor networks starting to refuse Medicare Advantage plans, things like that. And then you go to try to change during open enrollment, and you're finding that it's either not able to or it's cost prohibitive to. So let's talk about what's going on out there. So first of all, Medicare Advantage, it's very popular and I get it. And I have plenty of people that are clients of ours that argue I prefer Medicare Advantage, and I get it. I understand that. There's a lot of perks out there. But insurance agents are out there promoting it, doing dinner seminars, educational, stuff on it. But really they're trying to show you why Medicare Advantage is so much better. Okay. So that's the first part of understanding this. They're being sold. They're selling Medicare Advantage. The other side of this is, they have a way to spin things a little bit to make Medicare Advantage look so much better. Okay. First of all, it's largely funded by our government. It's less expensive. There's broader coverage. All of these wonderful things, especially when they're talking about Medicare Advantage versus just Medicare. I can see the comparison. It definitely makes sense. Medicare versus Medicare Advantage. I would take Medicare Advantage. It's easy to sell because of these low premium costs, perks like dental and vision insurance. This stuff's all getting bundled into it. Drug coverage, all these things are getting pulled into a Medicare Advantage plan, and they make it sound so much better. But really what they're doing is just comparing it to Medicare. And yes, compared to Medicare, Medicare Advantage plans can be wonderful. Okay, but the reality is we have to remember with Medicare Advantage, there are things like copays, there's deductibles, there's all those ancillary expenses that you're going to be responsible for along the way, just like the traditional health insurance we had in our work-based plans and most of our lives. Okay, but on top of that, what people are now realizing, what our clients are start regretting, is when they do actually have health problems, finding actually qualified care within their networks and all the stuff they have to go through to get that qualified care. This is where they start regretting their Medicare Advantage plan. So understand, you have a limited network of doctors. Okay, a lot of these specialist doctors are going to need pre-approvals from insurance. They're going to need some type of authorization from the insurance company before you're allowed to go there. You'll have to get referrals from other doctors. There's all these other ancillary problems that nobody talks about. And this, when we talk about cancer or any of these other bigger issues that are out there, they start running into a lot of problems with these Medicare Advantage programs. Okay. So, well, again, Medicare might not be the answer. Just switching over to Medicare, traditional Medicare, can be too expensive for most people. You have that same monthly premium because all Medicare Advantage does is takes the Medicare premium and sends it to the insurance company. So you still pay the Medicare premium, but now you have that same monthly premium, and after reaching a deductible, in most cases, you're going to have to pay 20% copays. And that's unlimited in what you're exposed to. You can be exposed to a lot of costs if all you have is Medicare. And that's why people get Medigap policies, Medicare supplements, same thing, just different terminology. Okay. And so these Medicare supplement policies get all confusing until you actually look at the standardized chart out there. You have to understand that these supplements to Medicare are there to cover what Medicare doesn't. And so Medigap is federally standardized. All companies must follow the Medigap coverage chart, period. It doesn't matter where you go, they will all have the exact same coverage. And the most popular plan is Plan G. Plan F is no longer available for people, and neither is C, but nobody ever really used C. Plan G is the one that covers everything except Part B deductible, which is only $240 in 2024. Meaning, if you have Medicare and you have this Plan G, Everything is covered medically. If you go to any facility that covers that takes Medicare, they have to take your plan G that will pay everything Medicare doesn't. So you have to understand that this is the ultimate coverage for people. And yes, will you end up paying monthly extra money for this? You will. You're trading that extra monthly. You'll start off somewhere around, it depends on zip code, somewhere around $100, and it'll get bigger every single year. Yes, it will get more expensive every year, but you no longer have those copays. You no longer have those big deductibles. And honestly, the world is your oyster. You can go to any doctor. And that is really what a lot of people need later in life. And that's something that I find a lot of our clients end up regretting, is that Medicare Advantage program was really fun and nice and covered lots of fun stuff earlier in retirement. But then they start regretting it and wishing they were on Medicare plus a supplement when they start getting older and have more ailments that they need help with. Okay, so what's the problem? Well, let's talk about these enrollment periods. First of all, you've got your initial enrollment period. Nobody can turn you down. Your 65th birthday or the day you retire after your 65th birthday, you have that 6 months before, or sorry, 3 months before, 3 months after, 7-month window where nobody can deny you. You can get Medicare, you can get Medicare Supplement, you can get Medicare Advantage, you can do whatever you want. So you try to pick the best one for you. The salesman says Medicare Advantage is best, and that's what typically ends up happening. Okay. If you choose to go Medicare plus a supplement, the supplement open enrollment is after your 65th birthday. It's a 6-month window. Nobody can deny you. You can pick any plan. You can get your Medicare supplement. That's the Medigap policy. Now, after that, after you've enrolled, now 2, 3, 5, 10, 20 years from now, you want to change your plan. You want to go from Medicare Advantage to Medicare Advantage, go for it. It's during open enrollment. You want to go from Medigap policy to Medigap policy, go for it. You can do it during open enrollment, but you try to go from Medicare Advantage to Medigap. You want to go back to Medicare and get a supplement, you're going to have to qualify for it. You have to be healthy. And that's where the problem is, because you don't really worry about it. Your Medicare Advantage plan is perfectly fine when you're not having health issues. When you're healthy, Medicare Advantage is just fine. But then you try to switch, and this is where everybody's having trouble. Okay, your open enrollment, you have 2 periods. It's weird. I always thought there was one, but there's 2: end of the year and beginning of the year. And you can try to change your plans. You can go from one to the other, and there's plenty of salespeople cold calling away trying to find ways to make a buck, and that's what they do. And if they can upgrade your plan or find the same plan with a less expensive carrier, wonderful. That sounds great. But if you really actually need to change from Medicare Advantage to Medigap, this is where we find our problems. You end up being stuck. Okay, insurers can deny coverage to beneficiaries transferring from Medicare Advantage plans to Medigap or base their prices on medical underwriting. Sure, we'll take you, but it's going to be $500 a month, whatever, when it's normally $100 a month. I don't think so. So this is where the problem comes in, and this is what I want people to understand. Those Medigap policies, they look great, especially when you compare them just to Medicare. But when you look at them compared to Medicare plus a supplement, if you've got a little room in your budget to pay that extra $100, $200, $300 a month for that Medigap policy, that'll cover everything Medicare doesn't, that will expose you to a lot less expenses over time if you're unhealthy in the future years. So this is where the problem is in our system. Our system makes it very difficult to switch from that Medicare Advantage to the Medicare plus the supplement, the Medigap policy. So you have to understand that that's the issue, and hopefully you're facing the choice of Medicare Advantage or Medicare Supplement, and you all have to know that you have to be healthy if you're going to try to make that switch. So the way you're going to fix this is be proactive. We need to know that later in life we're probably going to have more health issues. And so before you have those health issues, maybe you want to try doing Medicare Medicare Advantage earlier in your retirement. That's fine. Go for it. But just know it's difficult to switch. And so switch before you have health issues. Okay. All right. Hopefully that perspective helps everybody. Again, not direct advice. Everybody's in different situations. There's lots of great Medicare Advantage programs out there. Some people love them, but trust me, later in life, there's a lot brewing out there, and the trend is not good for these Medicare Advantage programs. There's a lot of doctors that are deciding not to take these plans. So, need any help with any of this? Yourinvestmentcounselor.com. You can book appointments, even a free 30-minute meet and greet just to get to know me and see what I do. Or book hourly appointments, whatever it is that you want. I'm always happy to help. Our full classes are fpfeaz.org. That is a nonprofit that we run and do full form education all over and live on Zoom for the public to consume. And certainly give us a call anytime if you want. If you haven't liked the videos, like them, subscribe to the channel, and I will see you next week. Thanks again.